Population aging is one of the greatest social and economic challenges that the European Union is facing. By 2060, 155 million Europeans, 30% of the total EU population, will be 65 and older. This trend is putting pressure on EU health system, already affected by budget shortages and a reduction in the services offered. In 2013, about 13% of households in EU were composed of a single aged over 65. Almost half of all women aged over 85 were living alone. In 2011, there were almost 2 million women aged over 65 living alone. Better care and sustainability of health services calls for innovative ways to address the needs of older adults. European countries spent on average 0.6% of their healthcare expenditures on curative home and rehabilitative home care and 3.5% on long-term nursing care at home. The number of people receiving home-based care would need to more than double between 2000 and 2050 in all of the EU countries. Given a choice between care in an institution or at home, most people would prefer to stay in their own home. The development of home care has been identified as a possible solution, but several conditions need to be met to ensure that it becomes a real solution. Current disparities between EU countries, even between different regions, in the organization and delivery of home care should be smoothened. Social and healthcare services should be better coordinated and integrated. Investments in the professionalization of home care practitioners should be fostered, and the European Union should play an active role in this regard. CARESS is an ambitious project that aims to overcome the skills gap identified in the home care for older adults. CARESS will offer a clear picture of the main roles, competencies and curricula of home care professionals working both in health and social care at older adults' own homes in different EU countries. For the first time, this information will be collected and systematized in a EU framework available for free in a web-based platform, in order to support designers of vocational education and training in the field of home care to set up effective courses to address skills gaps. Specific tools integrated in the online EU framework will guide the registered users to identify skills gaps and design VET modules to address them. There are ways to engage with the project, and CARESS is looking actively for supporting partners. These are stakeholders who profess an interest in the project and willingness to get updates about its main progresses and results. Each supporting partner can define freely the level of involvement in the project they would like to establish. The most active supporting partners will be able to contribute to the review and integrate information in the EU framework, provide their experience and share their own perspectives based on their professional profile and/or country. In such a way, the EU framework will be alive and built in a bottom-up approach and will represent accurately the current situation of home care in Europe. You're one of our stakeholders. The VET provider, designer or teacher. A unique occasion of a systematized view on home care in Europe. A support to identify skill gaps, also with a comparison with other countries. Step-by-step guide with practical tools for designing compensative modules for filling HHCP's skills gap. For home care professionals, a support for improving your practice and learning from the comparison with other countries. A support to understand better rules of home care, roles and competencies of other HHCP in your country. A unique occasion for formalizing our role and competencies at local, regional and European level. For policymakers, support to share and collect best practice in the field of organization and training of the home care staff. Inserting your details to actively contribute to the framework is very easy thanks to the interactive tutorial on the website. Your details will be shared in order to give extreme visibility to your profession and contacts in the whole Europe. CARESS framework is the only tool that collects and makes home care practitioners' details available in all European countries.